There's also a new space now in brain tumors where we don't just use chemotherapies, but we also use other treatments such as immunotherapy-related treatments.
The drug that we mainly use in brain tumors is a drug called bevacizumab. And the other name for that is Avastin or MVASI, or different brand names for that. This is an exquisitely expensive drug. We got to run you through all kinds of tests before we give it to you to make sure you're good. We got to make sure that your blood pressure is good because it can cause blood pressure issues. We got to make sure you don't have any protein in your urine because it can cause that. And we got to make sure that all your labs are good.
If it's immunotherapy or chemotherapy, that can go everywhere else and target the rest of your body. But this is also why we keep a really close eye on our patients to make sure if there's any early signs of toxicity or side effects that we're able to adjust treatment or treat those side effects so we can get back to treatment.
It's an IV drug and it's a targeted therapy. And how it works is you have something called VEGF, VEGF, and that's vascular endothelial growth factor, and it's floating around our body. And that promotes red blood cell growth and actually blood vessel growth. And tumors need blood vessels. That's how they get their food, right? So what the Avastin does is it actually blocks that VEGF, so it prevents tumors from growing blood vessels. So I tell people it's like the chemotherapy is like shooting at the cancer, and the Avastin or bevacizumab is like starving out the cancer because it literally destroys the blood. It doesn't allow the blood vessels to grow that the tumor needs. Brain tumors tend to be very vascular. They need a lot of blood supply. And so this works really, really well. The problem with this drug is it's IV and it's every 2 weeks. So patients, it's hard, right? When you have cancer, coming to the hospital every 2 weeks. But people do well with it and they tolerate it really well. The IV infusion is about 90 minutes, okay, the first time, and then it goes down to 30 minutes after that. But I tell people, if you're taking off work to come get this or you have a ride, I tell them half a day, plan half a day. Because by the time you get checked in, get the labs drawn, get the vitals done, the drug gets, and it becomes like 2 or 3 hours. So I tell people, don't plan on, going back to work after lunch, before lunch if you're going to do that. It seems to really give a good quality of life to people because it can also decrease the swelling.
At the University of Cincinnati Cancer Center, we are always here to answer any questions you and your caregivers may have as you navigate this journey.